Good morning. Thanks for joining us. Banner University Medicine is encouraging its patients to take a moment and breathe. The fact is, you and your family are in for great care. And here to walk us through what the role of a pediatric ear, nose, and throat physician is and what it means when a child is tongue-tied is Dr. Jonathan Young. Doctor, thanks so much for joining me here today.
Thanks for having me, Alex.
Pleasure to sit down with you. So first of all, let's talk about sort of an overview of what a pediatric ENT actually does.
So pediatric ENT is very comprehensive, and we basically treat everything from below the brain down up to the collarbones. And we'll treat any age of patients from day-old infants, newborns, all the way to syndromic patients that have been born with certain syndromes and carry that syndrome into their adult life.
Right.
Yeah.
And obviously you're a specialist, so people and their kids usually see the pediatric physician first and say there is something going on where they have to be referred to an ENT. What are some common symptoms and signs and things that parents have to look out for to know that they have to take that extra step?
So where my subspecialty training would come in would be for the general population, would be for recurrent ear infections, tongue-tie, as well as just sore throats and issues with sleep and snoring.
Okay, and you mentioned tongue-tied. That's sort of one of the topics we're going to cover today. What does that really mean, and is it something that can be fixed?
So tongue-tie is usually something that we see in newborns, day-old infants, and they're usually running into issues with breastfeeding or latching, and it's because their tongue is attached too close to their actual jaw. And so that limits the movement of their tongue, which then can affect how they latch onto the nipple and actually draw the milk into their mouths.
Okay. How common is this that it happens?
It's fairly common. Usually maybe 20 babies may have it. Whether or not it plays a role into how they're feeding depends on the baby themselves and the remaining anatomy of their face and the roof of their mouth.
So it's not something necessarily that parents and doctors may catch on to immediately, right? Right. It's something that could come down the line. Is there a fix for this type of?
Yeah, it's a very simple intervention that we can do in the office if the baby is cooperative. Or if the child is older and they're still having issues with it, I can take them to the operating room and take care of them there.
Now, does it cause problems? I mean, I imagine you'd have it fixed before they can speak, right? Or maybe sometimes you don't.
Sometimes you don't. I've seen children around 5 years of age that have had issues with speech development. I've also seen teenagers that have come in also with speech development issues.
How does a parent know, when work with their pediatrician, to know that their child needs to see an ENT?
So with the pediatricians, they want to make sure that they're taking their kids in for their routine well-child visits and making sure that they bring up all the issues that they're having in terms of growth, in terms of development. And then the pediatrician will definitely be helpful in terms of identifying any issues that may need my subspecialty training.
Excellent. And we're watching some video here of Banner Health. Can you sort of talk for just a moment about the experience when a family and children and patients visit you there at Banner Health? What's it like?
So I actually run 2 clinics, one at the main campus by the university hospital. And that clinic is our newest facility. It was just opened up this past January. And we've only been there for about 8-9 months now. And when patients come in, they'll be kind of funneled towards the pediatric portion of my ENT clinic. And I have a pediatric nurse and a pediatric medical assistant that help intake the patient and make sure that their entire visit is very pediatric friendly. Right. And then I have a second clinic over at the Wilmot Clinic. And at the Wilmot Clinic, it's a pediatric specific facility with general pediatric practitioners as well as other subspecialists. Well,
and if you're wearing that bow tie too, kids are going to come in and be like, he's friendly, he's cool, he's going to take good care of me. And so we talked about some of the common symptoms that a parent should look out for in their children, but there are also some uncommon ones that parents should kind of, they might not actually be able to tell, but maybe they could. What are some of those?
Some of the more common ones would include, from my subspecialty training, would be cleft lip and cleft palate. And so those are pretty evident. You'll see a break in the lip or a big gaping hole in the roof of the mouth. Other less common issues would be noisy breathing, because I do treat any laryngeal issues or issues with the voice box. And then pretty much any lumps or bumps in the head and neck region.
Well, I'm sure you can say to parents watching this that the earlier you can catch any of these problems, the better, right?
Definitely.
Because as you grow and mature into an adult or a young adult even, it can cause even more complications down the road, right?
Right, definitely.
So the earlier you can tend to these, the better.
Right.
Very good. Well, doctor, a lot of important information. You know, people don't often think about this every day, but the fact is that ENT health, ear, nose, and throat, is so essential to living every day. I mean, how you sleep, how you eat, how you breathe, the whole
Right.
9 yards. I know that I've had my share of allergy issues, and my ENT has certainly helped me, so it can definitely help kids as well. And Dr. Young, thanks for your time today.
Hey, thanks for having me, Alex.
All right. Now, for an appointment with Dr. Young, call 520-694-8888, and you can also learn more by visiting bannerhealth.com.